Hi all. So now I'm going to talk about prevalence and incidence of mental health problems and the disorders. Right. So before going to the topic, it's very much important to know about the terms incidence and the prevalence. So we'll see what is the meaning of incidence. So incidence is the number of instances of illness commencing or of people becoming ill during a given period of time in a specific population. So incidence is nothing but the number of people or the new cases of illness at a particular time in a given population. So incidences can tell us how many new cases of a particular illness have been suffered by in a community. So in the community, how many members are suffering from the illness or a new illness? So that number when we get, it is called as the incidence. So we'll see what is prevalence. What is prevalence? It's frequently used epidemiological measure of how commonly a disease or a condition occurs in a population. How common a particular disease or a condition is in a population. That when we study, it becomes the prevalence. Prevalence measures how much of some disease or condition there is in a population at a particular point of time. So I think you have understood the differences between the incidence and the prevalence. So incidence is the number of the cases of the mental illness or the any kind of a disease in a particular population at a particular period of time. Whereas the prevalence is to what extent, or we can say it is the term which is going to measure to what extent a particular population is suffering from a disease, okay, at a given point of time. So that is called as the prevalence. So what is the prevalence of mental illness abroad? So we are going to see around the world abroad what is the prevalence of mental illness. Mental disorders are common internationally and in India. 1 in 10 children have diagnosable mental disorders in a given year. So in a given year, among the 10, at least one of the child is having one or the other mental health problems. If you take the family, what is the prevalence? 1 in 4 families has at least one member with a mental disorder. So this is the prevalence of mental disorders in the family. So prevalence of mental disorders in India. So you have seen internationally. So now let us see in India what is the prevalence of mental disorders. The All India national rate, that is the urban and the rural, to be estimated as 65.4 per thousand population. So if you take the rural, okay, we have the rate as 64.4 and the urban rate of the mental disorder is the 66.4. Thus, the urban rate is marginally higher than the rural rate. So you can say the mental disorders is more common to about 2% difference. Okay, there it's more common in the urban community than the rural community. So if you take the prevalence of all the mental disorders, okay, in India, what is the prevalence? We have got different mental disorders like schizophrenia, we have depression, we have bipolar disorder, we have anxiety disorders, we have child disorders. So we are going to see the prevalence of the disorders in India. So for schizophrenia, so if you take the condition of schizophrenia, the rate is observed, the rate of the schizophrenic cases in India is 2.3 per thousand population. So the affective disorders includes all these depressive disorders or the neurotic disorders. In India, the value is observed to be 31.2 per thousand population. So the mental retardation in case of children, it is observed to be 4.2 per thousand population. So the most widely prevalent disorders which are observed is the depression and the anxiety, which is 18.5%, okay, per thousand population. The depression rate is 18.5 per thousand population. So if you take the differences between the rural and the urban, it is observed to be 2 per thousand higher than the So the difference is, if you take the urban morbidity rate is observed to be 2% higher than the rural morbidity rate. So in the urban community, if you take the mental disorders rate is 66.4, whereas the rural community it is 64.4. So only 2% difference is there between the urban and the rural community where the mental disorders are distributed. So the studies reported prevalence rate of psychiatric disorders among the children who are ranging from 13 years, which is about 94% per thousand population. Okay, since children and adolescents form the 40% of the total population in India, approximately 4 crores of the population require the professional help. Okay, so they require the psychiatric treatment. So you can understand to what extent the mental disorders are distributed in India. So who are the population who are affected with mental disorders? We can say risk population who will be affected with the mental disorders, right? Who are developing the mental illnesses. So we have the female gender. So why female gender is because they have a lot of hormonal changes, whereas during their developmental stages. So a female gender has a lot of hormonal endocrine changes, a lot of adjustments that they need to make in the particular environment, from one stage of development to another stage of development, different roles what a woman assumes. So because of those, the female gender are at risk compared to the male gender. Child and adolescent population. So again, the children and the adolescents, when they haven't got if there is no proper family dynamics, or when the adolescent is entering into when the child is entering into a stage of adolescence, there are various changes again which happens in the environment of adolescents, which are going to may become a negative impact on the adolescent child. So that is the reason why a child and adolescent group is also a risk for the mental disorders. We have got students, students, for example, they are not performing well in the studies, they may have average IQ, or pressure from the parents, pressure from the teachers, or bullying conditions. So all these can also contribute to the students' mentality, right? So can end up with the mental disorders. We have got a geriatric population. So when it comes to a geriatric population, they are the ones who are going to have a drastic change again. There may be a stage of retirement, there may be loss of the spouse, or they may be neglected by the children. So all these financial changes and the relationship changes, they can end up with loneliness or depression, or they can end up with the dementia, memory problems, right? So that condition, that stage of development, that is the geriatric group, is also a risk for mental disorders. People suffering from chronic medical conditions. So people who are suffering from the chronic medical conditions, like people who are having rheumatic arthritis, or any kind of asthma, or any cancer, right? Or diabetes, hypertension, all these people who are risk for developing the mental disorders because of chronically being medically sick. Right. So next is disabled population. Again, if you take a disabled population that is physically challenged, or they are having a lot of discrimination in the society, they may have to face embarrassing situations, or they may feel inferior about themselves. So such conditions, when there is a disabled population, so it can be a blind, or or a deaf, or it can be any kind of physically challenged person who may have the inferiority feeling or neglected by the society. So thus those conditions, they can also be the risk factor for mental disorders. We have got the disaster survivors. So disaster survivors who have experienced any kind of a disaster. It can be a natural disaster or a man-made disaster, any kind of a disaster. If they have experienced and they are not able to come out of that particular crisis, right? So they may end up with a post-traumatic stress disorders or anxiety, phobia, phobic disorder. So this population, any people who have been survived in case of disasters, also may require counseling to come out of the condition. Next, we have the refugees and individuals with the poor family, social and economical support. So people who are living in this marginalized population, who are having a poor family or poverty or poor social and economical support. So such kind of individuals, and who are refugees who come from other countries to different places, so they are also at risk of developing the mental disorders, maybe because of the adjustment problems, because of the financial crisis. So these are the group who are at risk of developing the mental illness. So moving on to the economic cost of treating the psychiatric patients in India. So very, very important, the economic cost. So there may be a chance, even though there is a mentally ill person in the family members will not take the client to a psychiatric setup or to a psychiatric hospital because of the poverty or financial difficulties. It can be, right? Because psychiatric treatment is not a treatment which can be given for a week or for a month. It is a long-term treatment which requires a lot of patience, a lot of support from the family. So they may fear that they may not take such kind of a patient to a mental hospital. So let us see what is the economic cost for treating the psychiatric illness in India. The prevalence rate is 200 per thousand population. In simple words, approximately 20 crores of population requires the professional help. Each mentally ill patient may require about 500 rupees per month for the mental health care. So it is estimated like per person for a month. A mentally ill person, he requires about 500 rupees for the mental health services per month. So this includes the medication costs. This 500 rupees, it includes the medication cost, the doctor's fees, the traveling cost to meet the doctor. So all these put together, it requires about 500 rupees per month for the mental health services. It is a high time to stop all this, debate about the prevalence rate or the rate of mental illness in India, and to concentrate on the actual actions that we can deliver to the client by investing and improving by delivering the services to the client in India. So this is about the prevalence and incidence rate of mental disorders in India. Hope you all have understood the topic. Thank you.